Hi, I'm Dr. Tyler Tolbert from Smile Now Dentures and Implants. If you smoke and are considering dental implants, this is one of the most important conversations we can have. We're not here to judge or pressure you. We're here to help you protect your investment and get the best possible result from your treatment. Why smoking matters. Dental implants rely on your body's ability to heal and bond the implant to the bone. Smoking directly interferes with this process. It reduces blood flow, slows healing, and makes it harder for your body to fight infection. What this means in real terms is a higher risk of complications, a higher chance of implant failure, and a shorter lifespan for the work that you've invested in. Before surgery, setting yourself up for success. The weeks before surgery are your opportunity to dramatically improve your outcome. Patients who stop smoking, even temporarily, heal faster and have significantly better long-term success rates. Think of this phase as preparing the foundation. The healthier the environment, the stronger and more predictable the result will be. After surgery, the critical healing period. After surgery, the implant is bonding to your bone in a process called osteointegration. This is the most delicate phase. Smoking during this time slows healing, increases inflammation and infection risk, raises the chance that the implant may not integrate properly, and many implant failures we see nationwide happen during this healing window, and smoking is one of the biggest contributing factors. Now there's also long-term effects. Even if implants heal successfully, continued smoking increases the risk of bone loss, gum disease around the implant, and long-term failure. Dental implants are designed to last many years, often decades, but their longevity depends heavily on the health of the surrounding bone and gums. We know quitting smoking is difficult, and most people need support, not just willpower. At Smile Now, we can help you with smoking cessation therapy. This may include nicotine replacement options, prescription medications when appropriate, and practical strategies to manage cravings. Also, we offer structured support and follow-up. Even stopping for a short period around surgery can meaningfully improve your outcome, and many patients find that this becomes the opportunity they needed to quit for good. At Smile Now, we also stand behind our work and offer a warranty on implant treatment under specific conditions. Because smoking significantly increases the risk of implant complications and failure, continued smoking will invalidate the warranty on implant treatment. We want your implants to succeed, and this policy is designed to give you the best chance of long-term success. Our goal isn't just to place implants, it's to help them last. If you smoke, talk to us. We can help you create a plan that improves healing, protects your investment, and supports your overall health. When you're ready, we're here to help you take the next step.